Hey everyone, and welcome back. Today, we need to talk about something incredibly important, something that could affect millions of Americans on Medicare. Right now, more than 1 in 2 people on Medicare are enrolled in a Medicare Advantage plan. But there's a massive change on the horizon, and it could directly impact your coverage. Starting in 2026, more than 1 million Medicare Advantage plans are expected to disappear or be merged. That means if you don't review your options carefully, you could lose your plan, your doctor, or even your prescription drug coverage. So in this video, we're going to break down 3 things very clearly. First, what is happening with these Advantage plans? Second, why it's happening? And third, and most importantly, what you can do right now to stay protected. Let's dive in. So, what exactly is happening? The big insurance providers have already started preparing for these major changes. Companies like United Health Group, Humana, and Cigna have all signaled that they'll be trimming or consolidating their Advantage plans in 2026. United Health alone plans to discontinue several of its PPO options, which will affect more than 600,000 members across the country. And here's the critical part: if your plan gets discontinued, you won't be automatically switched to another one. There's no automatic rollover. If you don't take action, you'll simply revert back to original Medicare. And that's a problem, because original Medicare doesn't include prescription drug coverage and has no limit on your out-of-pocket costs. That's why understanding what's changing and preparing early is so crucial. So why are PPO plans disappearing first? PPO plans are popular because they give people more flexibility. You can see out-of-network doctors or specialists without a referral. But that flexibility costs insurers more money to maintain. With healthcare costs rising rapidly, many insurers are cutting back on these more expensive options first. And this is all happening at a time when Medicare costs themselves are climbing. Part B premiums are projected to rise from around $185 to over $206 a month. Part D deductibles are expected to go above $600, and those small copays that used to feel affordable, they might double or even triple in 2026. So even if you manage to stay covered, your total yearly costs could still go up significantly. So let's look at the big picture. Why is all of this happening now? The short answer is a combination of rising healthcare expenses and new government regulations. Healthcare costs are simply growing faster than inflation. People are living longer, using more medical services, and new treatments, especially for chronic illnesses, are more expensive than ever before. On top of that, the Inflation Reduction Act put new limits on what seniors pay for certain prescription drugs. Now, that's great news for patients, but it also means that insurers now have to absorb more of those medication costs. And there's another factor. Several large insurers are currently facing lawsuits and investigations related to their billing practices and claim denials. Many of those cases involve the use of AI and prior authorization tools. All of this adds up to less profit for these companies. And when profits drop, insurers often respond by cutting plans, trimming benefits, or raising premiums. So 2026 isn't just another year of small updates. It's shaping up to be a major reset year for the entire Medicare Advantage market. If your plan is affected, don't panic. You still have options. But you will need to act before the deadlines. Option 1 is to choose a new Medicare Advantage plan. You can stay with your current insurance company if they offer an alternative, or you can switch to a different insurer entirely. But be careful, a zero premium plan isn't always the best deal. Sometimes, those plans come with much higher copays for hospital stays or specialist visits down the line. Option 2 is to switch to original Medicare with a Medigap supplement plan. Normally, getting a Medigap plan requires medical underwriting, and people with existing health conditions might be denied coverage. But if your Advantage plan is canceled, you automatically get something called a guaranteed issue right. This means you can sign up for specific Medigap plans without having to answer any medical questions, no denials, no waiting periods. For many people, this could be the best opportunity they've had in years to switch their coverage safely. Okay, let's talk about deadlines, because this is where you really need to pay attention. The annual open enrollment period runs from October 15th to December 7th. If your plan is being canceled, you will have a special window that extends until December 31st to pick a replacement. Please do not wait until the last minute. The systems get incredibly busy, and mistakes can happen. If you missed a deadline, you could start the new year with no coverage at all until the next enrollment cycle comes around. Keep an eye out for your annual notice of change letter, which should arrive in September. This document will list exactly what's changing in your plan. Then use the month of October to compare all your options and make your decision early. You've paid into Medicare your entire working life. Make sure that investment continues to work for you. Take the time to review your plan, talk with a licensed Medicare advisor you need help, and make an informed choice before these 2026 changes go into effect. Now, I'd love to hear from you. Have you already received a Medicare notice in the mail? Are you worried about possible changes to your plan? Share your experience in the comments below. When we talk about what's happening in our own states and counties, it helps everyone make better decisions. Thanks for watching, and remember, staying informed is the best way to stay protected. Make sure to subscribe for more updates.